Okie Country 101.7. It's time for Lauren Rich to join me here. Rich Consulting, and why in the world is it men are more successful in therapy? You have piqued my curiosity, so I have to know why men seem to do better with therapy. As a licensed therapist, I know that you probably have had this experience.
I see mostly men, probably 90 to 95% men, which is really abnormal considering the field, but with my specialty it's at least semi-understandable. But really the reasons that men are so successful in therapy is because they are motivated for change.
Why are men more motivated than women?
Well, I don't know that they're more motivated, maybe some are, but statistically women go to the doctor more, and that's doctors across the board. That's just not your primary care doctor. Women go in before anything is a major problem. There's more of a preventative mentality, and most of the time by men call me, they are either facing divorce, already divorced,
fix it mode.
Something has gone terribly, terribly wrong. Some are, actively suicidal on a regular
That's tragic.
basis. Well, I mean, they're doing the preventative thing, but boy, I mean, we are to the worst of the worst sometimes by the time they call.
Mm-hmm.
So they are more motivated for change, I think, than the average patient, whether male or female. They generally have to face losing something because they'll know it's a problem for, 5, 10, 15, 20 years and not do anything about it.
They can go a long, long time.
Oh,
huh?
yeah.
So
but once we run the risk of actually losing something, our life, our job, our marriage, those kinds of things, then they're willing to make that phone call.
Wouldn't they have an easier time if they just made the decision earlier?
Well, of course. That would make my job a lot easier.
Right.
But, if you're not ready for change, it's not going to happen. And
how do you know when you're ready for change, though? Sometimes you just think, this is the way that it is, I just have to deal with it. But
you have to want something better for yourself.
But the reality is, if they'll really stop and think, there could be an easier way. It doesn't have to be your reality.
Yes.
Right?
Yes. And
especially these real severe cases.
Most of them who come in tell me, I am not here for me. I am here for my wife, my kids. If it were my choice, Doc, I would check out and live in the boonies and be off the radar completely.
Yeah, but you can't do that when you have a family and kids and school and real life.
At about session 6 or 8, they finally start to realize that they are there for themselves. It takes me a couple months. But we can shift that perspective and that desire for change from being family focused, which is important, but being focused on yourself and making things better.
Right.
The other kicker for men is that they are so goal oriented. So many of them are such high achievers that they want to walk away with tangibles. They want something in their toolbox. They want to be able to actually see a change in life. And some of them have told me outright, before you, I saw 7, 8, 9 therapists. And that's not saying that those 9 therapists are bad. I would hope that some of them were at least good. But he may not have been ready for change at that point.
Right.
Once they acknowledge that they don't want to live life like this anymore is when we actually start seeing a productive difference each and every session.
Well, it takes a lot of effort and work and meetings and appointments and stuff to fix it. So
it is work. And I am so, and maybe I just do better with men because I am so assertive. That's not for every woman out there, and it's really not for every man out there. But with my population, I can be really assertive and direct and say, look, you can either choose to live the way you're living, which has not been working for you, or we can make an agreement that these are our goals and this is what you want to accomplish. But you have to be the one to make that choice. I can't do that for you.
So statistically, men do better in therapy than women.
I don't know if that's a statistical item, but in my anecdotal experience.
Well, I was getting ready to ask you, has that been your experience?
Retention with men, specifically retention with a lot of my combat veterans, is exceptionally high in comparison to the civilian population.
Okay, so they're calling once they're at the end of the line.
It's bad.
Somebody's at the end of the rope somewhere.
That's right.
They come in not doing it for themselves. They don't think they're doing it because someone in their family is pushing them that way because they're at their wits' end and they're probably coming down to the wire going, look, you get this fixed or this family is over kind of thing. So what are the signs maybe when to go? Because sometimes you can go from very mild signs or a family doesn't really communicate well together. Things may be worse than you think they are, number one.
If you're at risk of losing something, a something or a somebody in life, a job, a person, a child, a parent, whatever that may be, that should be a wake-up call for you that you probably need to change your behavior.
Right, and you're going to need help with that.
Mm-hmm.
And that's what you do.
Absolutely.
So.
And it's great. If we were not productive, I wouldn't continue to do it. But this has to be something that they have to make that choice on. So let me put it to you this way. You would never live with a broken arm for 15 years, would you?
Of course not.
Of course not. You'd go and get it set, and you'd correct it, and you'd move on with life.
Right.
But for whatever reason, men specifically choose to suffer for an excessively long period of time, 15 to 20 years, before they will, sometimes longer, before they will ever make that phone call.
How effective is counseling?
Oh, very.
Or therapy, I
very.
should say.
I mean, medication is helpful, but medication and therapy is really productive. It's an amazing combination. But a lot of my guys don't want to take medication, so we just do therapy, and we're still really productive. We make ground every single time, and there will be a transition point for a lot of them where they dread seeing me those first 4 or 6 sessions until we can actually build rapport.
Well, you're so
and
nice, I doubt that.
and get to rolling down the tracks. We're chooching along, and then about session 6, they'll say, "I actually wanted to come see you today."
That's
And
good.
that's when I know. That's when I know. Or when they make statements like, "You've changed my mind about therapy."
Yeah.
That's when I know that
now
I
they're
earned my
gonna be-
paycheck.
Well, they're going to be more open to you, and then you can start getting down to the real root
That's
of the cause.
absolutely right.
And when you find the real root of the cause, then of course you can apply the cure for the cause.
That's actually right. That's right.
Cool.
We set that broken bone, and then we get to move on with life.
Well, boy, the way you put it, we're going to set that broken bone.
We are. It's going to be painful for a short time, but we'll get through it, and then life will be better.
Lauren Rich, our guest this morning with Rich Consulting. Talk all about how to make contact with you.
918-912-2266.
Yep, and you have a YouTube channel. They can find you there.
I do. Yeah, if you're too
Find you on
scared to come to
Facebook.
therapy, you can just go to Rich Consulting on YouTube and get their therapy for free. Yeah.
Of course, it may not be specific to your
That's right.
your thing.
That's
so
right.
It's your best make
It
the
won't
phone
be as
call.
specific and it won't be as effective, but it takes people a while. It takes people.
You love working with people, don't you? You have a passion for this.
Yes, yeah. I think that is a fair word.
Why are you so passionate about it?
Yeah. I don't know. I think, with the specialty population of combat veterans, my husband is a combat veteran, and just knowing as much as I do about it, it's one thing to be a provider for something. It's another thing to have that in your life all the time, and I think that's when passions develop, is when it's with you all the time.
We'll just leave it right there. So perfect. Thanks, Lauren, for being on the show this morning.
Always a pleasure.
Lauren Rich of Rich Consulting here on Okie Country 101.7. Wow, that was good.
Happy with it?